common peroneal nerve. Welcome to this video. In this video, you will learn the origin and course of the common peroneal nerve, its division into deep and superficial branches, the muscles and skin each branch supplies, and important clinical correlations like foot drop. Let's get started. The common peroneal nerve is the smaller terminal branch of the sciatic nerve. It arises in the lower third of the thigh, just above the popliteal fossa. It passes into the popliteal fossa along its upper lateral boundary, just beneath the edge of the biceps tendon. Now, it runs over plantaris and the lateral head of gastrocnemius. It runs over the fibular attachment of the soleus to wind around the lateral aspect of the neck of fibula, to reach deep to peroneus longus, where it divides into two terminal branches. Deep and superficial peroneal nerves. Introduction. Deep peroneal nerve. The nerve lies lateral to the anterior tibial artery in its upper and lower thirds, but anterior to the artery in its middle third. This is the nerve of the anterior compartment of the leg and the dorsum of the foot, beginning, course, and termination. It begins on the lateral side of the neck of the fibula. It enters the anterior compartment by piercing the anterior intermuscular septum. It then pierces the extensor digitorum longus and comes to lie next to the anterior tibial artery. In the leg, it accompanies the anterior tibial artery and has similar relations. The nerve ends on the dorsum of the foot, close to the ankle joint, by dividing into the medial and lateral tarsal artery. Terminal branches. The lateral terminal branch turns laterally and ends in a pseudoganglion deep to the extensor digitorum brevis. Branches proceed from the pseudoganglion and supply the extensor digitorum brevis and the tarsal joints. The medial terminal branch ends by supplying the skin adjoining the first interdigital cleft and the proximal joints of the big toe. Branches and distribution. Muscular branches supply the muscles of the anterior compartment of the leg. The extensor digitorum brevis on the dorsum of the foot. A cutaneous branch supplies adjacent sides of the first and second toes. Articular branches supply the ankle joint, the tarsal joints, and the tarso-metatarsal and metatarsophalangeal joints of the big toe. Clinical anatomy. Paralysis of the muscles of the anterior compartment leg due to injury to deep peroneal nerve results in loss of the power of dorsiflexion of the foot. As a result, the foot is plantar flexed. The condition is called foot drop. This is usually caused by injury or disease of the common peroneal nerve due to trauma, leprosy, or peripheral neuritis. Sensory loss is confined to first interdigital cleft. Effects of injury to the common peroneal nerve. The common peroneal nerve is extremely vulnerable to injury as it winds around the posterolateral aspect of the neck of the fibula. At this site, It may be injured by the direct trauma, fractured neck of fibula, or tightly applied plaster cast. The characteristic clinical features are as follows: motor loss, foot drop, due to the paralysis of muscles of the anterior compartment of the leg, dorsiflexors of the foot, loss of extension of toes, due to the paralysis of extensor digitorum longus and extensor hallucis longus, loss of eversion of foot, due to the paralysis of peroneus longus and peroneus brevis, evertors of the foot. Sensory loss. On the anterolateral aspect of the leg and whole of dorsum foot, except the areas supplied by sural nerves. Clinical correlation. Due to paralysis of the dorsiflexors and evertors of the foot, the patient cannot stand on the heel. Superficial peroneal nerve. The motor branches of the superficial peroneal nerve supply all the muscles of the lateral compartment of the leg. The sensory branches of the superficial peroneal nerve supply most of the skin on the dorsum of foot, except in the cleft between the great and second toes, being supplied by the deep peroneal nerve. The lateral margin of the dorsum of foot, including the lateral margin of little toe, is supplied by the sural nerve. Thanks for watching. We covered the common peroneal nerve and its clinical relevance. Like, share, and subscribe for more quick anatomy lessons.